All right, we're live.
All right, Marco, thank you. All right, good evening, everyone. Thank you for attending this information session tonight on the latest state guidance and how Fairfield Public Schools is beginning to prepare for the reopening of the 21-22 school year. My name is Mike Cummings. I'm the superintendent of schools, and I'm joined tonight by three officials of our Town of Fairfield Health Department. So if they could introduce themselves, maybe Dr. McDonald, if we could start with you.
I'm Bruce McDonald. I'm the medical advisor for the Fairfield school system.
I'm Jill Mitchell. I'm the nursing supervisor for the town of Fairfield.
I'm Stan Cleary. I'm the director of the health department.
All right, thank you all. Thank you, three of you, for being here tonight. It will certainly help us provide the most up-to-date and relevant information for everybody attending. Just to get started and to set some parameters around where we are, it is August 3rd. We're just shy of 4 weeks before the beginning of the school year. We're at a place, and Mr. Cleary will get into this in a little bit, but we're at a place, obviously, where the news is concerning to all of us around, essentially, the general direction of the COVID-19 pandemic. At the same time, the Fairfield Public Schools has learned a lot over the past year and is going to be applying that information into the new school year as we go forward. We are, though, expecting that more information will be forthcoming in the next 4 weeks, and certainly after students arrive back in schools on the 30th. So we will more than likely have not only share with you and publish out more information that as it becomes available, but hold another webinar as we get closer to the start of the school year. And if necessary, we'll do something after the start of the school year. Communication on this, on the updates, on how this situation evolves as it has over the past year will continue into the new year. So I just want to set some of that context. We are going to answer every question we can tonight. There is some of the questions we received in advance, and let me take a moment and thank everybody who submitted questions in advance. Some of those questions we do not yet have answers to. We are dependent on others for those responses, and again, once we have that, we'll pass that on. But again, we will do our best to answer the questions as we are now, the information we have now, and in the context of where we are right now with the current transmission rates and things like that. So with that said, Mr. Cleary, I turn it over to you to provide some additional context for us.
Sure, yeah, and I'm sure I am not alone in saying that, you know, all of us would like to get things to get back to normal, would like to lose the mask, would like to get back to the way things were. But unfortunately, you know, we're just not there yet. And that's really, you know, not only my opinion, but that of the CDC and the State Department of Public Health. We're just not quite there yet. You know, all of us has experienced impacts from this pandemic, you know, from tragic losses of friends and family members to financial challenges, loss of jobs, changing and challenging school and work conditions, isolation, desperation, depression, and other impacts have all been experienced by many of us. You know, and I think everybody acknowledges the, you know, the educational, the social, emotional, and the behavioral impacts resulting from the pandemic and the burdens it presents to uniquely to children and our school staff. You know, so the overarching goal as we approach this year is you know, to try to get things back to as normal as possible, getting all the kids back into school full time. And so that's what we're looking to put into place, is some strategies to do that. And the Delta variant recently presents a challenge to that, that we still have to keep up some of these mitigation strategies. A few weeks back, the CDC had come out with some recommendations saying that only masks would be required for those unvaccinated. And then a few weeks later, due to the impacts of the Delta variant changes throughout the country and in Connecticut, the CDC changed that and went back to universal masks being recommended for schools coming up. You know, and in addition, they've said, you know, everybody should wear masks indoors if you're in a state that's of substantial or high transmission. And so Connecticut is in one of those states, as is most of the country. Is Connecticut's in substantial. Most of the country is in either substantial or high. Only 5 states in the District of Columbia are not in substantial or high right now, and that's, you know, dramatically increasing. Some 87% of the country at this point is in a substantial or high category. So, and even the CDC indicated yesterday they're likely to change that recommendation to that regardless of the category, that they're going to be recommending masks be worn inside by those vaccinated and unvaccinated. And so, you know, many of you will recall that we had some initial goals in the initial part of the pandemic, just about, you know, flattening the curve and trying to prevent transmission and severe outcomes and limit hospitalization, prevent deaths, and to limit the overwhelming of the healthcare system. And so the good thing is with vaccinations, we've taken some significant steps towards resolving some of those issues. But so, you know, as happens in life, the goals shift as you move through an event like this. And so now we are at a sort of a different set of goals. You know, now that we have vaccine available and effective therapeutics for those in the hospitals, you know, it's no longer just about that, but there's some other goals that we're trying to take care of, you know, mostly about promoting vaccination. We want to make sure we're promoting vaccination as much as possible, because that affects that primary goal that we talked about, the initial goal. But also it helps provide some protection for those who are unvaccinated, can't be vaccinated yet. And an additional goal the CDC has been talking about is really the need to limit transmission to prevent the emergence of new variants. And so what we are trying to do is prevent the formation of new variants that were either more transmissible, that are more virulent, meaning they make people more ill, or you know, even to variants that are can overcome the vaccine. And so that's what we look at as some of the goals moving forward now, that limiting transmission works to help achieve all those goals. So right now, Delta is the predominant variant in Connecticut. And according to the CDC, it's more than twice as transmissible as the original lineage strain, they call it, back in a year ago in April. And in, you know, this new strain is causing increases throughout the country, throughout the state, and even in Fairfield. And so, you know, we're seeing cases trend upward. We're seeing hospitalizations in the town of Fairfield. We're seeing hospitalizations trend upward in the county. And so these are just like what has been driving the decisions at the CDC, is we're seeing it starting to happen here. We're not sure how long this wave will last. You know, there is some hope that it may be a shorter type of wave as experienced by England and India, but you know, nobody really knows exactly how. So we can talk about some activity. So what's going on now? We looked at this July compared to last July. You know, this July we've had, you know, 87 cases reported in just the month of July, versus last year, the same time, we saw 52 cases. So we're seeing more cases. And we expect that 87 number to go up a little bit because of, you know, we normally get some reporting delays from labs. So the cases at the end of the month will be reported late. And of those 87 cases, about 20 or so of those, 23%, have been breakthrough cases. And of the cases that we're experiencing now, 23 of those are in school-age children. And so that's some of the activity that's going on. And so let's talk about vaccination. So we're working hard to continue to promote vaccination. We worked hard to vaccinate ourselves. We did over 25,000 vaccinations just through the health department. And so right now for the state of Connecticut, we're at 64% fully vaccinated. And then when we look, excuse me, that's for Fairfield. 64% is fully vaccinated. That's the total population. But when you do the age breakdowns, and we're limited by what the data available to us at the state level. And so for the 12 to 15 age group, fully vaccinated, we're currently at 58% of the population. So under 2/3. For the 16 to 44 age population, we're at 65% fully vaccinated. 45 to 64 years old, we're at 85% vaccinated. And the 65 and older, we're at 93% vaccinated. I'm rounding up there, or rounding to the nearest whole number. So, you know, we have made some good progress, but there is still more progress to be made, especially with some of the younger ages. You know, we're, you know, you know, 1 out of every 3 people that someone would meet, you know, in the general population would be unvaccinated, you know, and, you know, everybody who's under 11 at this time would be unvaccinated. You know, and I want to talk a little bit about, you know, that so far in the pandemic, you know, it's young kids aren't immune to this. Yes, they have less severe impacts, but you know, we've had in 0 to 9-year-olds, we've had 22,000 cases in Connecticut, and 10 to 19-year-olds, we've had 42,000 cases in Connecticut. So, you know, in that age range, the 0 to 19, it's 64,000 people. And so, you know, we are seeing impacts in this age range. We've seen cases, you know, and clusters and outbreaks move through that age group at events, and even in a few limited cases, we saw some transmission that we suspect was in schools. So, you know, and one of the things that's concerning, and I'll somewhat wrap it up here, is, you know, talk a little bit about, you know, a recent article the CDC put out in their MMWR regarding the outbreak in Provincetown, and I think it's Park-Hampstead County up in Massachusetts. You know, so in early July, I think it's the 2nd to the 17th. You know, they had a couple fairs and festivals and events, and it's a very popular time to visit up in Provincetown. And they put out a study, and they updated it actually yesterday on the CDC call, where they are now up to 965 cases, COVID cases, during that first 2 weeks of July there. But the interest that, you know, while the case numbers is for a large area is not overly significant, what was concerning to the CDC is that 765 of those cases, or 79% of them, were in vaccinated people, or what they call breakthrough cases. And of those 765 people, 658 of them became symptomatic. And so these are vaccinated people getting infected and developing symptoms. And so that sent some concern to the CDC, and is not the sole, but one of the factors that contributed to the CDC making the recommendation that, you know, even vaccinated people can become infected, and more importantly, that they become symptomatic and can lead to transmission. And so, what we want to do, and we talked about those goals earlier, is, you know, is to limit transmission to meet those goals that we talked about, but also, you know, limiting transmission in schools achieves the overarching goal that we've talked about even earlier, is, you know, to get kids back into the classrooms, children back into the classrooms more, and to be there. And, you know, if we limit this transmission, we're also limiting time out of the classroom due to, you know, illness, even though it may be a mild illness, to isolations that are required from cases, even if they're asymptomatic, and the quarantines related to those. And so I'll wrap it up there, and we'll move on to the questions. Mike, did you want me to jump in with the masks to start talking about that? Can't hear you, Mike. You're muted.
Mike, you're muted.
Mike,
you're muted.
I am, and I have control of that. Sorry about that. Yes, Sans, if you could start with the mass, and then
Sure.
I'll get involved with the start to talk about some of the operational pieces for school. I know there's a lot of questions about how we're going to begin, and safety precautions and things like that.
Sure. All right, so as it stands right now, and a lot of people are aware of this, current Executive Order 12A, which was extended by Executive Order 13, and the Connecticut DPH rules and State Department of Education rules that are empowered by that act, are currently in effect, and they require universal masking in schools until September 30th. So that's an executive order, that's regulation, that's not optional, that's in place right now. And this recommendation is consistent with, both the American Academy of Pediatrics and the CDC recommendation for universal masking. The governor has had some discussions in the press lately about his team considering changing that potentially in the next few weeks, but has said, they're still considering it, and if they take no action, it means the executive order stays in place until at least September 30th. So that's what we have to deal with right now. And the health department is supportive of the recommendation for universal masking, and we would not likely, unless a lot of things can change, prior to school starting and prior to September 30th. In terms of cases and rates and all those types of things. So they can change and recommendations can change. But right now, the major public health agencies and are recommending universal masking. And so we are not likely to disagree with that and to support the recommendation for universal masking. To you, Mike.
Thank you, Sans. So let me talk a little bit about, Sans has brought up the issues or some of the questions around starting of school. Let me start there, and then we can talk more about the details. School is on the calendar to begin for students on Monday, August 30th. It is our intent to open on Monday, August 30th, to open with the full day schedule, 5 days a week for all students. So there is no early delayed start Wednesday or early release Wednesday. It would be 5 full days a week. All students in. Distancing will be at the 3-foot distance as we ended the school year. And that will be at all levels. As Mr. Cleary already mentioned, the mask will be in place per right now. Where we know right now, that would be an expectation to begin the year. Some of the other pieces that go around that, and I'm going to apologize in advance if I jump around, because we are responding to the questions, and some of the questions in some areas touch on issues around the others. But one of the things that related to the start of school, the question has come up: what would drive changes in the guidance? So what might drive changes in the learning model plan? What would possibly bring us back to a hybrid or a remote? These aren't things that any of us want to consider. And honestly, at this point, we don't know. I know that there's a full-on commitment from both the federal and state government to keep students in school full-time. And that is our intent as well. Again, many of the lessons learned last year that we all experienced and went through showed that was possible when the appropriate mitigation factors were in place. So, again, I think to get ahead of that question is ultimately be a little irresponsible, because we really don't know what scenario might prompt something like that, and speculation doesn't really, and none of us any good. But in order to maintain, going back to this, in order to maintain that full 5 day schedule, there are the procedures that we'll put in place. So again, the 3-foot distancing. The 3-foot distancing at minimum at lunch, and more if we can do it, because again, students would not be having their masks on while they're eating. You will not see the plexiglass barriers, the pop-up barriers that went on the desks and in the lunchrooms. Those are not going to be around this year. Questions have arisen around cohorting. Classes will cohort, but it seems that one of the top questions was, will students have to cohort when they're at recess? And we do not believe that will be necessary at this point. We believe that students, if again, maintaining the appropriate distance, even unmasked, cohorting will not be necessary. So those are just a couple of the pieces that have come up, and I'm going to come back to some more in a second. But I don't know if Jill or Dr. McDonald or Sands want to comment on any of that.
I would just like to add, thank you, Mike. I would just like to add that not only do we have the outdoor recess and no cohorting, but also in any of the activities that take place outdoors, be they recess or even class time in good weather, if you can move your classes outside for something, and maintain the distance with the classroom situation, that masks will not be necessary when outside. I know that, we think of 6.5 hours of the child masked, but there are breaks built into the schedule. There are the outdoor recesses, if you can do any classes outside. Certainly at lunch, they have breaks as well. And it's just not a continuous wearing of the masks.
Thank you. And that,
You're muted yourself, Mike.
You're muted again.
again, I did it again. I apologize. The mass breaks are going to be built into the schedules again, and the tents are still in place and will be utilized for those outdoor opportunities when they arise. In addition, one of the questions that we got was around the state DPH state DPH had put together that kind of a continuum of what information would drive a change in the learning models. It modified during the course of the year, whether you'd be full in, remote, hybrid, remote. And there's been no update to that. We don't know if that information is going to be changed. But at this point, we've not received any further information on it. And again, it's important to stress that, as we learned last year, that really is just at this point, guidance, not necessarily direction. There's a lot of on the ground local circumstances that go into that. We've had questions about after school events. Well, actually, let me take one step back and say there's been, before we get to after school, during school, the presence of visitors in the building. One of the things that we're going to have to look at is building density, giving the need to appropriately separate students and also the adults. We're going to have to be mindful of visitor presence in the buildings. That we're going to play this out a little bit. We have to look at the beginning of the year schedules for the schools. But any type of event that, for example, would draw a crowd, whether it's a classroom-based type of event or a school-based assembly, at least to start the year right now does not seem likely. We wouldn't want to increase density in the schools and compromise that distancing issue. On the other hand, after-school events, so the PTA-sponsored events that take place in classrooms or in the gyms, those types of events could well take place. Again, everything, and then into the evening, scout meetings, recreation, basketball, those types of things. At this point, we expect that will happen. As again, anybody participating in that, though, would need to follow the guidelines. So again, following the distancing guidelines, being masked. As long as those are happening, we believe that it's safe to do those things in school this year. And that's a change from really how we ended the year last year, for much of the year. Let me see if I can get one more thing in. And cleaning. Let me talk about cleaning for just a quick second. The cleaning protocols will remain in place. Desks will be wiped down at the end of every day as individually. We will maintain ongoing presence during the day in the restrooms and around those types of areas. Stanza, Jill, and Dr. McDonald, I don't know if you could comment. There's been some questions around the issues of, as you were aware from last year, when the virus first arose, there was a lot of questions about surface transmission and wiping down objects, wiping down, when papers were turned in, they would sit in the inbox for a day or two. I don't know if you have any thoughts on where we are now as the guidance and knowledge of the virus has certainly changed in the past year.
Yeah, Mike. Oh, I'm sorry. Go ahead, Bruce.
Made pretty clear that surface transmission is really very minimal. Some of the places that are high touch, the cleaning of the bathrooms once a day includes the high touch, but routine cleaning of desks and surfaces beyond routine is probably no longer indicated. It's just additional work that's not needed.
Thank you. Jill, did you want to add to that?
Yeah, I know there was a specific question that was submitted about the gym equipment. And I think we had established some answers to that last year, but just to reiterate, we would always encourage the children to wash their hands before and after using any of the gym equipment, but the wipe down of the gym equipment is not really indicated at this point. So I think we can go forward with that.
Great, thank you. Thank you both. So we're going to be pulling back on some of those requirements going to the new year, again, based on what we've learned, not only in Fairfield, but everywhere where COVID is touched. There's a question around communication. This was a pretty common question about how we will continue. Will we continue to communicate positive cases in the district? And the answer to that is yes. We will follow the format that we did in the during the course of the 2021 school year. We'll bring back the data dashboard. So all that information will continue as needed during the course of the year, and we'll follow what we did at the end of the year. If we're not seeing a case, if there isn't a communication on any given day, it's only because there was no case that day. There were no cases that day. That leads to a question that has come up, and I think this is evolving guidance too, and I don't know who wants to take it, but every one of those communications, well, almost all of them involved mentions of quarantines, and the data dashboard tracked the number of students and staff who were in quarantine. Can any of you, who among you would like to talk and address the issues around quarantining and how
Sure.
that information's changed?
So, and again, I've said it in various meetings and written communication that, we'll always look to take the least restrictive measures that we can while still protecting the public's health. And I think that's a general practice that we're trying to follow together. So in relation to, the health department, along with the school nurses and the school administrators will continue, and our contact tracers will continue with contact tracing. We'll continue with case isolation and quarantine of contacts. What has changed is that we will be moving towards the shorter recommendation of a 7-day quarantine with a test on the 5th day. And as long as that test is negative, you can return on the 8th day. So we'll be shortening the quarantine period moving forward. In addition, in the CDC guidance, there's an exemption for students in classroom at desk with properly fitted masks on, that the definition of a close contact now goes down to being less than 3 feet apart in that particular circumstance. And so we will adopt that. And so we think this will have an effect of both shortening the quarantine period, so lessening that impact, as well as lessening the number of people that are required to quarantine. And so we think that'll have a positive effect. We will, hopefully it'll lead to less whole class quarantines. But that really depends on the quality of the information we get back and the confidence in the information that we get from those involved. And so I'm not saying it won't happen again, but we think that these changes will provide some confidence and the elimination of sort of outside the contacts outside, because we just don't think that there's transmission is occurring outside. And so we think there'll be this will help with that, lessen both the length of quarantine and the number of quarantines.
Thank you. Where we're talking about quarantines, the topic often related to quarantine is the issue around travel. Who can speak to the travel guidance, and what we'll be doing in Fairfield around the travel guidance?
I'll take that, Mike.
Thank you, Jill.
Connecticut, as of March 19th, 2021, the travel advisory is no longer in effect. What we will be using and recommending are the CDC recommendations for both international and domestic travel. I'm not so sure I'd really want to get into the details of that. Certainly, if anybody is traveling and wants to know what the recommendations are, my office is happy to discuss it. It may change. It may change. I know last week, at least, Governor Lamont was talking about looking into domestic, interstate travel bans, or at least quarantine periods. But at this point, we're just using what the CDC recommendations are. Certainly for vaccinated people in domestic travel, it really amounts to just self-monitoring. But that's not all of our children. All, children under 12 are not vaccinated, and certainly a significant number of others are not as well. But if anybody wants any more specific information, we can give you the links. We can talk you through it so that we can get you back to school as quickly as we can.
Thank you. I want to address the topic that's come up, and it comes up in a couple different ways, is the issue around remote learning. And remote learning, as we look through the questions, really is the same term is being applied in two different circumstances. One of those circumstances is in the remote learning, as in last year's Remote Learning Academy. So for a long-term solution for families with either children at high risk or family members at high risk. So that's one use of remote learning. And the other question has come up around students who are in quarantine, or students who are actually test positive, that use of remote learning. So that's a shorter duration remote learning. Let me talk about the longer term remote learning definition right now. And there was a call with DPH this morning, and the commissioner, State Department of Education commissioner, was asked specifically about a question around remote learning in those circumstances. Right now, under state guidance from the Connecticut State Department of Education, remote learning for a longer period of time is not allowed because they're essentially what the state is considering this is an unexcused absence, and it would not be, those days would not count. They would not count towards attending school. And this information, by the way, is available on our website. It's also available on the Connecticut State Department of Education website. This remote learning guidance that came out about 2 or 3 weeks ago. So the guidance is not as clearly written as we'd all would like, and we've relied most recently on some follow-up communications, and this example this morning is the latest. But that for that long-term remote learning under current Connecticut State Department of Education guidance, that's not going to count for school attendance. In the short term, what the CSDE is saying, and this is also included in that document, is it's turning to local boards of education to develop a policy for how they would approach that. So for a student who's on quarantine or a student who's in who tests positive, what would be the learning provisions applied? And we'll be working on that. The Board of Education Policy Committee will be looking at that. As we talked about last year, I mentioned, I think towards the end of the year, that providing remote learning instruction for those short-term assignments is not something that we're planning on doing. That's the Fairfield Public Schools take on that. That in the past, when students were out of school for 4 or 5 days, work would be assigned, work would be picked up. And that is right now our intent. But again, this will be going forward, and more will be coming on that. In addition, I want to be clear, this is another example of where we are now and what could potentially change at the State Department. I think the State Department guidance is pretty clear. They are working parenthetically on a longer term solution for remote learning, but that will not take place in the 21-22 school year. There's legislation that was passed this year that mandates that the State Department of Education come up with a remote learning plan, long-term remote learning plan for the 22-23 school year. So that's something that will be taking place during the course of the year. But for right now, it would appear that the way will best meet the needs of students who are out of school for a short period of time will be through makeup work or work assignments delivered through Google Classroom or to be picked up at school. And that kind of, let me talk about testing first, and then if folks from the health department want to talk about vaccinations, which Stan's mentioned at the beginning. But questions have come up around concerns that there would be either mandatory testing or mandatory vaccinations. That is in nobody's cards. The state Department of Ed and the Governor's Office, Department of Public Health, is talking about implementing a testing program. We learned more about that this morning. It's important to keep this in mind that the testing program would be strictly voluntary, that under their guidelines, the parents would sign a consent form for their children to be tested. Schools would essentially partner with a testing facility who would come on the school sites, test those children whose parents had consented for them to be tested. And then within 24, 48 hours, it would be a pooled test. So within 20 to 48 hours, the school system, the health department would get notification if there were positive cases among that, and parents would then be contacted. That's something we're looking at. At the earliest it would begin is in the middle of September. But again, the information is relatively new to us, and it's something that we have to have further discussion about. And if we do decide to do something like this, we would first find out from our families if there's interest in participation. Whether we do that through sending the consent form or just simply a yes or no, but we need to know that before we go forward. We don't want to take people's time if it's not going to be something that parents would consent to. So again, that's something that's in process, and information is developing on that. And the State Department of Ed is prioritizing that for public schools who want to access it. And the priority would be, I should mention, for students in K-6, students who are under the age to be vaccinated. I don't know if any of you want to add to that, or if you want to go strictly to the issue around anything more to add around vaccinations.
The only other thing about the testing is that's once a week, so be done weekly.
Yeah, and there's currently no push that I've heard for mandatory vaccination. That essentially that under the emergency use authorization that it's currently under, that it's not even allowed to be considered. So I know others are pushing it, and universities are doing things like requiring vaccination for you to be on campus, but then they say you can participate online. But yeah, currently no dialogue at the state level that I've heard about mandatory vaccination.
Thank you. We had a number of questions about ventilation, and Mr. Papa George responded to me tonight about those. So if you don't mind, I'm going to look at my email right now and kind of go through those relatively quickly with you. But there was a number of questions about ventilation that I want to make sure that we address. So one of the questions was about, this is the question, what is the reason the school's mechanical HVAC systems were not retro-commissioned last year? That process is a lengthy process. That process has begun. We're in the middle of that process. But as we've discussed before, there's two steps to this. One is the study of each of the buildings, and the second is the actual retro commissioning. When this takes, first of all, there's a considerable cost around not only the study, but then the corresponding work that takes place. And it's also important to keep in mind that one of the side effects of the state asking school districts to do this was that everybody went to do it, and it became a supply and demand issue. But we are committed to that, and there will be further follow-up to the Board of Education in the next couple of months around the results of that work and how we'll be going forward. So we're close to having that completed, and that would be also included as part of the general and the greater HVAC conversation that the board is having as they look at the long-term planning, capital planning for the district. Again, we have updated our filtration systems to the MERV 13 filters in all of our buildings where those filters are appropriate and needed. And the outside air dampers are open to 100%. As the school year begins, we will be keeping our windows and classroom doors open to allow airflow throughout the building. And really what the state is concerned about is that airflow is happening. If we're in a situation long-term with this again, as we know from last winter, it gets a little bit more problematic when the cold weather sets in. But we're hopeful that this will be a fall problem, and we'll deal with that if we have to get to it. there was a question about cleaning products and are they green or it's important to remember that as Mr. Papa George says here, the state's green cleaning program has always and will continue to allow for disinfectants to be used. So green cleaning and disinfectants are not at odds with each other. And we do follow state guidance on all the products we use. Again, we talked about desks being cleaned every day. And I think that might be it. I do think that most of the stuff, let me just make sure I covered all this. I believe I covered all of it. I mean, essentially, it's important to remember that prior to COVID and after COVID, the improvement of indoor air quality in the Fairfield Public Schools is a commitment of the school system and our Board of Education. These are lengthy projects. They are costly projects, but the Board of Education is committed to seeing this through and building in a system that will allow this to happen in time. And again, I would urge you to continue to pay attention to the board as they move forward. I believe this will be on the board agendas in the first few months of the school year, and of course after that. But there'll be discussion around these topics in the next couple months, particularly. I don't know if there's anything that you would like to add about ventilation, airflow. Okay. All right. So I'm looking at our list, and I believe we've covered most of the topics that were on our list. I don't know if there's anything that I've left off or we've left off, anything other words we should share.
Yeah, I think we've got to most of them. Yeah. So
again, I first of all, I want to thank Dr. McDonald, Mr. Cleary, and Ms. Mitchell for being here tonight. As has been apparent, I hope to everyone from the very beginning of this, the partnership the Fairfield Public Schools has with the Town of Fairfield Health Department is fundamental to maintaining the safety and well-being of all of our students and our staff, and their work. Their work has been unprecedented this year, but their support for us has just been magnanimous and never-ending, and greatly appreciated. So I thank you, and to everybody on the Town of Fairfield Health Department staff as well. As we said at the beginning, this is where we are now. We'll be compiling the information that was shared tonight. We'll be getting that out to everybody in the form of some updated guidance. So that anybody who wasn't able to attend, or if you weren't taking notes quick enough, we'll get this all out to everybody. And there will be, as more information becomes available, we'll share that promptly with everybody. And as questions come up, we'll certainly hold another meeting to address those questions too, as the situation changes. So right now the collection form for the questions is closed, but we will open it up again once the opportunity is presented to us. Okay. All right. Well, thank you, Jill, Dr. McDonald Sands. Thank you very much for being here tonight.
Mike.
Thank
Have a
you.
good night, everybody. Take care.
Good night.